Welcome to this Autism Ontario webinar. Ask the Doctor, Improving Pathways to Timely Diagnosis. My name is Matthew Lay, and as always, I will be your host. Want to welcome everybody to this very, very exciting webinar. And before I get started, as always, I've got some housekeeping items, so bear with me here. Opinions reflected in this workshop are those of the speakers, the presenters, and do not necessarily reflect Autism Ontario views. Please note, Autism Ontario does not endorse any specific therapy, product, treatment, strategy, opinion, service, or individual. We do, however, endorse your right to information. Autism Ontario strongly believes that it's important to do your own research and make your own informed decisions, which is a big reason why we run these webinars, is to help keep you informed, get your questions answered, and get information out to you. I also want to review the use of language during this presentation. Autism means something different to everyone. Medical professionals, researchers, and providers may use one term. An individual or their family may refer to themselves or their family member differently. The different terms you'll hear used to describe autism are either a person first perspective, example, person with autism, or identity first label, such as autistic person. Person first language reflects the idea that autism can be separated from a person. It doesn't define them, similar to phrases such as living with autism. While identity first language reflects the belief that being autistic is an important part of a person's identity and cannot be separated. So respect both. We're going to be going in between those throughout the presentation. Now, before I bring our presenter to the stage, a reminder for you on a couple points. First off, submit your questions in the Ask a Question box at any time throughout this webinar presentation. Those questions will be filtered to me, and I will aspire to get you your answers live today. There is the potential that, as always, we won't get to all of your questions. And if that's the case, we will aspire to get you answers after the fact. Make sure you check out the resources tab. There's a lot of stuff in there that helps inform our conversation today. And finally, this webinar will be recorded and available on demand by tomorrow. So make sure, if you know anybody who you think might benefit from this, that you share this link with them. It'll be the same URL that you logged in on today. Finally, if you have any issues, please click on the help icon and the team will be there to assist you. Okay, that was a lot of information. And now that I got that out of the way, I'm happy to bring to the table our host today, who is Dr. Lonnie Zwaigenbaum. I did okay with that?
That was great.
Okay, well, I will be referring to you as Lonnie from here on out, making my life easier today. Lonnie, thanks for joining us. Before I sort of hand over controls to you, we did a social media program where we ask people to pre-submit their questions. And usually I start off with my big open-ended, but I think it makes sense to go to one of these questions, which is, we're talking about this today because there are some barriers to diagnosis, right? Can you talk about some of those challenges at a broad level before we dive into the presentation?
Sure, thanks, Matt. I mean, I think that as many people who are participating in this webinar are aware, I mean, there aren't quite enough specialized professionals to go around in terms of making sure that that children and youth and adults are seen in a timely way. And as a professional community, we need to be a little bit more collaborative and creative to make sure that we make diagnosis accessible and equitable. And if we think about the diversity of living circumstances across the province and Canada, we really need to think about sort of how things vary across different towns and cities, and how do we make sure that autism diagnosis is accessible to everyone who needs that type of assessment.
Right. And so what's helped informing your presentation, I understand, is a lot of lived experience in your own personal practice, but also some research. You got a long bio, so I don't think going through all of it, but maybe share just a little bit about how you come to this topic, what your experiences are.
Sure. So, I mean, I'm a developmental pediatrician. I also had the opportunity to train and learn from one of the most amazing researchers, Dr. Peter Zatmari at McMaster University, and also worked with Wendy Roberts and a number of amazing people in Canada. And they really taught me about the humanity of working with autistic people and their families, and striving to do better in terms of supports and accessibility of assessment and supports and services. So I've worked clinically. As you've said, I see people coming in for a question of a diagnosis of autism, and I've also done research around identifying some of the earliest signs, and also that relates to working with community colleagues in terms of helping them advance their practice so that they're more confident and skilled in terms of being able to provide these types of assessments.
Excellent. Okay. Well, I've gotten a little preview about what you're going to discuss today. So at this point, I want to get out of the way. To our audience, please continue to submit your questions. I see some have already come in. We're going to get to those throughout the presentation. So whenever something comes to your mind, get it in. Lonnie, you're in control. So if you don't mind just moving to that next slide and making sure that, there you go. And with that, I'm going to hand it over to you, and you'll be hearing from me shortly.
Okay, thanks so much, Matt, and welcome everyone. So I just want to start by sharing that it's kind of disclosure, so that my research does receive funding from a number of sources. My research doesn't have any industry funding, nor am I receiving sort of any industry funding. And I guess my other disclosure is that I grew up in Ontario. I did work at McMaster University after my training for about 8 years before relocating to Alberta 15 years ago. And I do miss Ontario and Ontarians. And although I'm not working directly in Ontario, I have a number of kind of friends and professional colleagues, and kind of have some sense of what some of the challenges are. And I have to tell you, working in Alberta, I think the challenges are pretty universal across the country and probably globally, in terms of how we approach supports and services for autistic people, and thinking about creating a system where people can access diagnostic assessment. So in terms of some of the general issues that I'll cover today, I will comment a little bit about what the earliest signs of autism are, but I'll also acknowledge that push the boundary around identifying earlier and earlier signs is not really the whole answer to how we make sure that people on the spectrum receive an appropriate assessment and diagnosis in a timely way. I'll talk a little bit about the range of professionals that can be involved in diagnosing autism, and also the question of whether all see a specialist or a specialized team, or whether there are multiple ways to approach this. I'll talk a little bit about factors that may influence the age at which individuals on the spectrum end up with a diagnosis. Is that just a limitation of the professional community, or are there genuinely individual factors that may also affect timing? And I'll also talk a little bit about healthcare needs of autistic children and people on the spectrum more generally. Along the way, certainly welcome Matt's to discussion after I present the slides. So I don't need to tell any of you about the challenges. Despite advances in learning about the earliest signs of autism, the average age of diagnosis remains around 4 to 5 years. Many families experience long wait times, and there is variable access, disparities related to whether people live in large cities or in more rural and remote areas. Certainly in the US, there's been clear data around disparities related to ethnicity. I think we're still learning about the factors that influence access to diagnosis in Canada, but there are certainly communities, including First Nations, Inuit, Métis, people from other ethnic groups who have a very different experience navigating the assessment and service system. In addition to assessment and diagnosis, autistic children and autistic adults also face disparities related to healthcare access. They're less likely to have a family doctor that coordinates their care and in a comprehensive way. I think a lot of autistic people find themselves receiving input from a walk-in clinic or through the emergency room. And certainly many families of autistic and non-autistic children find that it's actually really difficult to find a family doctor right now. And that transition to adulthood, it makes things even more challenging. I mean, if you haven't received an autism diagnosis by the time you're adult, you're facing a system that's pretty sparse. As well, even those who've had good healthcare sort of during the childhood years, many autistic children are seeing pediatricians. So when they hit 18, and it's time to transition to a family doctor, they're seeing a new physician who may not have the same level of experience and hasn't gotten to know them over the years. So, so really thinking about how to engage family doctors in the whole care process when people are young, rather than just waiting to the adult years. Some of the work I'll be presenting today comes from a task force that was established by the Canadian Pediatric Society. This included professionals from a number of backgrounds and associations, including pediatrics and family physicians and psychiatrists and psychologists, as well as parent leadership from the Autism Alliance of Canada and other parent leaders who contributed to the process. The task force ultimately generated 3 practice statements. So for pediatricians and other professionals doing this type of assessment work, to really think about what are the essential issues. And it really forced us to grapple with what really matters in terms of autism assessment and how do we make it more available to all families. So the first topic that was covered in these practice statements was early detection. So how do we make sure we identify the earliest signs? And the recommendations that came out of this group were really that all Canadian children should be monitored for early behavioral features of autism as part of the process of developmental monitoring more generally. Now, surveillance isn't quite the same as screening. It's not simply about having parents fill out a questionnaire at certain ages, but rather a process of making sure that that professionals have an open ear to really create an environment where parents feel respected and encouraged to share their concerns, and that rather than just sort of at one visit, making sure that there's an ongoing process of monitoring for some of the earliest features, and that when early features are identified, that further assessment is made available in a timely way. I mentioned that some of the research I've been involved in is monitoring for some of the earliest features of autism. The way my colleagues and I have gone about this has been working with families who've had a child on the spectrum and now a new baby, a younger brother or sister, that my colleagues and I have then followed over time, starting at the age of 6 months and then periodically into later in childhood. It's a project that I was involved with from the time I was in Ontario and have carried on through Alberta. So some of the earliest features, in a way won't surprise you if you're thinking about what autism looks like in a 3 or 4-year-old. But in fact, there are some of these features that for many, but not necessarily all children who are eventually diagnosed, that we can see even at the age of, say, 9 to 12 months. So these children may not respond when their name is called. They tend to be quieter and don't participate in that kind of back and forth vocalization that we see in infants who have more developed communication skills. They have reduced eye contact. They don't necessarily share the same degree of big smiles, that kind of joyful expression when interacting with their parents and other people. They may not use their eyes to direct other people's attention. They have difficulty moving from activity to activity. They may get stuck on a particular activity or a favorite toy. And even at an early stage, we start to see some of those sensory interests, so that intense focus on visual aspects of toys or being interested in how things feel. These can be subtle differences. They may not necessarily develop in all autistic children by the age of a year, but there's a remarkable number where you start to see some of these subtle features. So, on one hand, it sort of encouraged us, well, can we just educate community professionals to watch for these things, and maybe we can be making diagnoses in younger children. And in fact, there's a whole field of research that has really invested a lot of energy and kind of many groups working on looking for behavioral features, and some groups looking at kind of other ways of potentially identifying autism early in life through EEG or brain scans or subtle behavioral differences that one might even be able to pick up a cell phone app. But I think the challenge is that even though the word is getting out about what to look for some of the earliest signs, it hasn't really translated into kids being diagnosed at an early stage more consistently. And I think the challenge, as many of you know, is that often the rate limiting factor is not just about the professional recognizing some of the earliest signs, but rather what those professionals and families face once the referrals made. The main bottleneck in the system isn't necessarily picking up on some of these early features, but rather the long wait list that families are facing. And so again, we need to be a bit more creative and collaborative as a profession and think about what we can be doing together. So if we really want to change the system, it's not just about looking for earlier features of autism, but it's actually thinking about what is really needed for autism diagnosis. Can we build multiple pathways to diagnosis? Can we engage our colleagues in the community, for example, to make sure that there's multiple routes to diagnosis through partnership, through support, and putting families at the center. And that brings us to, sorry, go ahead, Matt.
No, go ahead. If you want to wrap that up, I do that section up. I do have a few questions from our audience that I'd like to.
Please.
Okay. First off, how do autism symptoms and diagnosis vary in girls? Are there any silent symptoms that parents should look for? Any general advice for diagnosing girls?
Yeah, it's a great question. I mean, I think as we're learning more and more, there are girls on the spectrum who are kind of flying under the radar of the professional community, and it is absolutely a concern. So of it may be related to just some of the subtle differences in social behavior across boys and girls and across the genders. I mean, it may also be a little bit of, there's a lot of professionals that are kind of, are aware that autism is diagnosed more commonly in boys and just don't necessarily, aren't necessarily looking at the kids that they're seeing through the same lens. I think it's less that the features are fundamentally different, but rather that all kids are different, so that I think there's a risk if people sort of adopt certain stereotypes of autism. So that somehow autistic kids aren't interested in being with other people, or the autistic kids aren't creative and don't have a sense of imagination. And I think those are the kinds of preconceptions that I think can put girls at a disadvantage. But I think if we keep in mind things like the features of autism are more about the flexibility in social interactions and or the ability to involve other people in your play. I think that, my personal experience is that if we just kind of open our eyes to sort of how autism is really defined and how it might apply across the range of just kind of personality styles, whether people are kind of more shy or more outgoing, one can certainly see the features in autism across that diversity. Another factor certainly that older girls and women talk about is just being very cognizant of their own differences, and sometimes sort of, doing what people have described as camouflaging. So recognizing that there's certain there's certain social expectations with other people, and sort of in a very conscious way, kind of masking some of those features. I think that's probably less of an issue with younger children, but it's increasingly a factor throughout childhood. So, what I'm going to be talking about in terms of how we think about autism and how we work with community professionals to become more equipped to do these types of assessments, we absolutely need to be sensitive to those real differences between boys and girls.
So I'm going to go to a quick one here, because you've said a couple times like community professionals and this, and one of the questions that came in through our social media campaign is, can diagnosis only be done by my family doctor, or are there other professionals who are able to diagnose?
So autism is one of a group of conditions, developmental health and mental health conditions, that are defined in a diagnostic dictionary, which is called the DSM. Current version is DSM-5. So those diagnoses ultimately can be made by a physician, a registered psychologist, or a nurse practitioner working in that specific area of focused practice. Among the physician group, family doctors are generally not the ones sort of making an autism diagnosis. But I think there's, I think as we're learning, it's possible that family doctors who have an interest in this area can receive some advanced training and develop an advanced practice interest in that area. When I'm talking about physicians today, I'm primarily talking about pediatricians. I mean, they are largely the community physicians that have been most involved in actually making the diagnosis. Really, all physicians should be involved in monitoring for signs. And I really want to acknowledge that there are many professional groups that are absolutely essential in terms of identifying kids and participating in the diagnostic process. But in terms of scope of practice, it does ultimately fall to physicians, registered psychologists, and some nurse practitioners to actually kind of finalize a diagnosis.
What's your recommendation if parents are seeing signs, but their pediatrician, I mean, they shouldn't refuse it, but it says the question from the audience really is, if they see signs, but the pediatrician refuses to have an assessment done, where should they look to and where should they go?
Yeah, great question. So, I'll cover that a little bit in the slides. I mean, part of it is, I'll just say that, part of it is, like, as a professional community, we need to reach that community so that not only are physicians more knowledgeable about the early signs, but respecting kind of the importance of listening to the concerns of families, so that families aren't finding that they're hitting a brick wall. I think practically, if a parent is finding that they're kind of getting stuck and hitting that brick wall and that their concerns aren't being heard, I think to work with their broader community. So if they're connected to the preschool system, if they have a community speech and language therapist, to kind of work with them to kind of articulate, kind of describe those concerns. I think sometimes the local Autism Ontario branch may be helpful in terms of identifying that go-to community professional or physician who who has an open ear and may sort of help the family reach that next stage. But certainly it's really essential that parents feel that they're being heard. It's important for people who work in a specialized area like me to recognize the reality that it isn't always so easy to navigate that system.
Right. Okay. Well, I'm going to take it as a hint that I ask a question that gets answered later in the slides, that it's time to move on with the presentation. So Lonnie, I'll hand it back to you for a while, and I'll be back momentarily with more from our audience.
Well, Matt, your question was a great segue to the next section of this presentation, which is really about like, what should autism assessment look like? I think for years, especially people who work in specialty centers have been focused on like, what assessment should we do, or how many people should be on the team, or should it be like a half-day assessment or a full-day assessment? But we're recognizing, hearing from families and really thinking about what really makes a difference ultimately in terms of addressing families' questions and needs, and helping kids and families on their way in terms of accessing supports and services. There are some broad things that we need to accomplish through diagnostic assessment. And as we think about these things, it makes us realize that there's never going to be a one-size-fits-all to accomplishing this well for all families. So, we need to be able to be definitive about making a diagnosis. Part of that is being able to explore other conditions that affect, like developmental delays or anxiety, other conditions that can occur along with autism or may overlap with autism, and making sure that we're really certain that a child has the autism diagnosis, rather than something that's different that may be presenting in a similar way. We need to understand that child or older person's individual strengths and challenges and interests to ultimately inform supports and services. So really getting enough of an understanding of that person's needs and strengths to start to think about services, but recognizing that some of that additional assessment can be coordinated with service planning. We, of course, need to do this in a way that's child and family centered. So ultimately, parents need to feel confident in the process. They need to feel that they've been heard. They need to feel that their perspectives and preferences and priorities have been respected. And that they're given enough information that they can get to the next steps. So how to access supports as a family, and how to access supports and services for their children. But this can be accomplished through kind of multiple ways. And if we think about the diversity of children that we see, we really came to the recognition that there are multiple ways to accomplish these goals in an autism assessment. And then, in fact, there are a number of people on the spectrum that can be assessed and diagnosed in kind of closer to home in their own communities, and not necessarily going to the traditional specialty center, which are often placed in large cities and are not as easy to access for people outside of the cities. So although every individual on the spectrum really warrants a really thoughtful, comprehensive assessment, some individuals may present with kind of more clear features of autism, and may not require the same same intensity or complexity of assessment in order to come to a confident diagnosis. As I'll comment in a moment, there's actually a lot of research and a lot of community experience now that individual clinicians or clinicians working with colleagues, either kind of right in their office or sort of collaborating in the community, can actually develop a high quality diagnosis that can support kids and families in understanding their needs and in accessing services. Often an essential component of that is having a partnership and ongoing mentorship and support from a specialized team, and making sure that when the community team isn't certain or feel like they need a bit of input, that there's a direct line of communication to that specialty team. But it sort of broadens the role of that specialty team, that not only are they seeing individuals coming in for assessment directly, but they're also providing that support and ongoing training. As I commented, there's lots of research evidence to support this now. A couple colleagues and I completed a review of research in this area, and really there were several studies that showed that community professionals and teams can be supported, trained, and mentored to do autism diagnostic assessments. With that training and ongoing support, their diagnostic impressions are in a high level of agreement with what the specialty team would have said. And where parents are asked, they also have a high level of confidence and satisfaction. And in communities that have been able to implement this type of approach, of course, they are now creating multiple pathways to diagnosis. Like there isn't just a one place to go, and that of course does create more spots for assessment and reduce waiting lists. There's actually been some amazing work done in Ontario around this type of approach. So one example, a colleague of mine just north of Toronto, Nicola Jones Scrofrey, has done a terrific job of what she is a developmental pediatrician working with community pediatricians, has done a fabulous job of creating these types, creating and supporting these community teams. There's also a group at Bloorview, led by Melanie Penner, Jessica Bryan, and Evdokia Anagnostou, who've approached this using a telehealth community of practice approach that's called ECHO, or Extension for Community Health Outcomes. It kind of looks a little bit like this, or at least it would if we were on a Zoom call. It's essentially a specialty team working with a number of community professionals and practices. Those community professionals have an opportunity to talk about children or adults that they're seeing in their practice, get input from their colleagues in other community practices, whether it's about diagnostic assessment or about ongoing support and healthcare management. And then the specialty team kind of weighs in as well to help the community practices fine-tune their approach. And this has been a way of accomplishing that goal of not simply kind of providing some initial training to community professionals, but making them feel connected and supported, so that they can continue to improve and refine their skills. And if they have questions or kids that they're seeing that they feel like they just need a little bit of backup, that they can access that kind of expert opinion. In Edmonton, we've had a training approach. I feel very fortunate to be working with a group of community pediatricians that have been really keen and motivated to get more involved in autism assessment. So we provided some initial training. So, kind of pre-pandemic, we brought them in person. They got a chance to see kids and sort of run through what was involved in writing a report and helping families access services. During the pandemic, we kind of shifted online and actually developed a virtual assessment tool that parents a set of activities that parents can do with their parents while clinicians observe. And then a key part of our training is that a colleague of mine, Lynn Sonnenberg, who's also a developmental pediatrician, actually goes into those community pediatricians' offices to be present when they see the first 2 or 3 children for an assessment, to be able to give them a little bit of coaching and to be present if questions come up. And then we've been able to provide that mentoring and an opportunity for those pediatricians to present on kids that they're seeing through that ECHO or Zoom approach, so they don't feel like they're completely on their own after the initial training. And again, like the group in Toronto and elsewhere have applied the ECHO approach, the level of agreement between the diagnostic impressions of the community pediatricians and what we think when we hear about these kids is very, very high. And it really allows that group of children to have a complete diagnostic assessment kind of through a community pediatrician. Sometimes it's their own community pediatrician who has that ongoing relationship and knowledge of what that child was like. I'm just looking at Allison's questions. Okay, great. So I think that's for Matt. So I'm just going to carry on. Great, thank you. And I'll just comment, I think this is part of a broader shift in how we're thinking about healthcare for autistic people, that we used to think about people on the spectrum as needing to go to the autism clinic. So this amazingly resourced, multidisciplinary place. You know, it's like if you have a complicated health condition like inflammatory bowel disease or diabetes, you go to the diabetes clinic and receive good care there, but you may end up waiting a long time for assessment. And certainly these autism clinics, you know, served only a relatively small proportion of the total number of people on the spectrum. And it was a bit of a disconnect between their needs as an autistic person versus their healthcare needs more generally. So rather than thinking about autism as a condition that needs to be managed by specialists, autism really is an identity, as Matt talked about. I mean, it's really an amazingly diverse community of children and families who need healthcare just like everyone else. So the more that we can embed healthcare, whether it's for assessment or ongoing support and management of developmental health, mental health, or physical health, the more we can embed that in a medical home, it just feels a little bit more integrated. Families can work with someone in their own community who knows the local services and gets to know them as a family over time. So, and absolutely, there's still a role for specialty clinics providing that additional support when things get a bit more complicated or there's a particular area that really requires the input of a specialist. But you have more continuity of care by centering a lot of these issues kind of in the child's kind of community physician's office. And oh, go ahead, Matt. Sorry.
Yeah, I was going to ask. I got a couple questions from the audience, but first I've got my own question here, and it's in regards to the echo chamber, the that you've been seeing in Alberta. There, can you speak briefly to the outcomes of that? Like, are you seeing changes in the community as a result, even if there hasn't been any studies or anything done just yet?
So in fact, I mean, I smiled a bit when you said the echo chamber, and it's a great way to express it. And yet it's a bit, even though echo is associated with an echo chamber, in a sense, echo, this extension of community health outcomes, is an attempt to take us out of our chamber and in a sense to open it up so that it's really, you know, that you don't have people working in silos. So, and in fact, there has been a fair bit of research done in echo and specifically in autism, and that the physicians participating in echo become more knowledgeable, become more confident in their interactions with kids and families. They're able to achieve skills in autism diagnostic assessment, and they're able to more confidently and competently manage kind of physical health and mental health issues in the kids that they're seeing. I mean, my personal experience is that, you know, it kind of goes beyond like a webinar for a colleague. It's not this kind of, you know, today is a little bit more like I'm doing all the talking, and it's great hearing people's questions, but it's a bit more of a traditional format. Echo is a lot more interactive. It's really the people outside of the specialty center that are doing the heavy lifting, not only presenting cases, but also commenting and advising their colleagues about, from their own experience, about how they would approach the situation. And I think a lot of us as professionals learn not just like from a textbook or from a lecture, but from real life, and real life working with our own kids and like the kids and families that we're serving, but also kind of being able to share experiences with our colleagues. And I think that's the essence of it, that it's less about the specialty team per se, and it's more about feeling part of a community that's working in a challenging area, but you're kind of learning from one another. So it is making a difference. And you know, the people, the folks in Ontario that are leading this work are really at the leading edge in terms of the outcomes that are being achieved.
And for those of you, I wasn't seeing it because I was just listening and watching the slides. But in the Q&A, some links to Echo have been sent out, so you can read more about it. Another question from the audience here. We have a few different questions that have come in from healthcare practitioners in regards to things. So I'm going to rephrase them and put them all into one. But when formal documentation, what formal documentation is necessary to access services and supports? What documentation should be accepted by providers?
Yeah, it's a really good question. And, working in another province, I think that it's a little bit, it varies somewhat across the provinces and to some extent across communities, but it's often tied to eligibility for the specialized services that are linked to an autism diagnosis. So I think the bottom line is, as professionals working in the area, we need to really educate ourselves about what the essential elements are. I think there's some kind of some universal aspects to it. Usually people making decisions about service eligibility are looking not only for kind of language around the features of autism to kind of fulfill the basic diagnostic criteria, but also information about how those features impact on the person's everyday life. So, because ultimately the diagnosis is about these features, but plus kind of impact on day-to-day functioning. So really highlighting that in a structured way, in terms of sort of across the social communication and restricted interest and repetitive behaviors, sort of how that impacts on the child and family. And then I do think that there is some language or particular areas where the decision makers are looking for people to elaborate. And I think that really emphasizes the importance of collaboration and cooperation between the specialty centers and people doing this in the community practices, because even though we may approach it in slightly different ways and in different environments, I think we can align our reporting and we can kind of share kind of tips about how to frame things and sort of what sections to include in reports to set families up for success in accessing services. Another essential part of report, of course, is providing families with the essential information that they need, like going home, what are the next steps, like how do you start the process of accessing supports and services. And again, doing this work together rather than isolation, we can kind of share these ideas and even report templates in terms of how to avoid reinventing the wheel and set families up for success.
What is included in a comprehensive assessment, and are there online training tools available for doing said assessment?
Yeah, I mean, honestly, as I was commenting earlier, I think we've really had to do a bit of soul searching about what we consider the gold standard assessment, and the reality is it's not one size fits all. I mean, we need a good understanding of that child's life story, so a good developmental history, and particularly for kids that are a bit older, understanding sort of how those features unfolded over time. An interactive assessment, so actually seeing how that child expresses themselves, how they play, their kind of social style directly, and whether that's us interacting with them, or now that we've had to get a taste of virtual assessment, whether that's actually their parent interacting with them. And then we need sort of a more comprehensive sense of their needs and strengths and challenges, and that comes from previous assessments and people's observation in other environments like school and daycare, and it also comes from having some information about their developmental level, like their independent skills, their language skills, and so it's hard for any one professional to do that in isolation, but we can kind of work together to gather those details. But what that might look like may vary across kids. I think is if we have those essential elements, it's not like you have to do this tool. So I mean, it's a bit controversial, but one example is that the Autism Diagnostic Observation Schedule is a really well developed research level interactive assessment that is a common feature of our comprehensive assessments. But I think there's a strong argument, and really endorsed by the Canadian Pediatric Society, that it's not a required element. So the bottom line is that the gold standard is really, a well-informed assessment with those elements and expert clinical judgment, sort of working with, kind of your colleagues in terms of understanding this child's needs. And, right. And I think part of the art and part of the cooperation is making sure that we're providing the right level of assessment, sort of depending on what the actual questions and the child's needs are. And it's not always the same.
Okay. One more question, and then I'm going to let you wrap up the presentation for our audience. If you haven't gotten your question answered yet, we're going to try and get to it. Keep them coming. We'll aspire to get you answers after the fact. What are the options while waiting for the assessment? The pediatrician that the diagnosis is not that straightforward, and we got to wait for the center to diagnose. In the area that this questioner comes from, it might take 1 to 2 years to get to that center. So, what recommendations do you have for them?
Yeah. So, I mean, I think that's the reality that a lot of families are facing, and why we're doing this work to chip away at that 2 years. I think we've all come to the realization, which parents have known for years, that even if you don't have a diagnosis, there's still a lot one can do, and that even where there isn't a definitive diagnosis, knowing that the child is delayed in their language and communication skills, that they're having difficulty with self-regulation, that they're getting stuck on certain activities and having difficulty shifting. I mean, those are real-life functional challenges that can be supported through the existing service system, especially with some input from people who have experience working with people on the spectrum. So through general early interventions, speech and language pathologists, working in if they're in a preschool environment that has appropriate therapeutic supports, and really working with the local service center to say, like, what can be provided as we're kind of in this process of accessing a diagnosis. I think that's where Autism Ontario and the local branches have a real leadership role in terms of helping parents know what their options are and kind of how to navigate that system. I will say from experience in Alberta, it really reinforces the Autism Ontario approach. It's often parents who are in the know, parents who've kind of gone through this. And I think that parents in leadership positions with professional organizations like Autism Ontario are often the MVPs in terms of helping families kind of find their way in terms of accessing the right supports.
Makes sense. All right, Lonnie, I'm going to throw it over to you to kind of close out the presentation today, and then we'll be back to wrap up in the last of the Q&A.
Okay, terrific. So I'm just going to comment that, we're talking about assessment today, and we're talking about the role of community physicians and other professionals. I just want to acknowledge that autism is a starting point. The diagnosis kind of provides a pathway to accessing supports and services, but ongoing healthcare needs are long-term, like any other individual, and people on the spectrum do have higher rates of physical and emotional health conditions, and again, this won't surprise anyone on the line, but the autistic kids and autistic adults are more likely have difficulties with sleep, GI issues such as constipation, higher rates of seizures, other neurologic issues, and then a broad range of emotional and behavioral health issues. And so that it's not simply about diagnosis and accessing those kind of initial supports and services, but it's really about kind of a more comprehensive needs and a lifetime of needs. I think one question that I heard is there's a lot of discussion about, like, what about kids that don't get diagnosed till later? I just want to acknowledge that there are certain elements about sort of what might contribute to later diagnosis. So Matt raised a question about girls and women, and there is growing recognition that can contribute to later diagnosis for the reasons I commented on earlier. I want to acknowledge as well that it's not only about sex assigned at birth, but there's high rates of gender diversity among autistic youth and adults, and that can create a more complex sense of identity, but also additional barriers to accessing diagnostic support and services. I also want to acknowledge that if kids have made it into school without a diagnosis, it can be even more complicated, because if they're not accessing the appropriate supports and there isn't an understanding of their needs, it can be pretty traumatic and stressful. And by the time that group of children is recognized and we're seeing them, that some of their frustration, anger may come to the surface as behavioral symptoms that can kind of overshadow the autism features, and we just have to be really sensitive. And then, and again, sort of multiple challenges facing people on the spectrum in the adult years. So again, to emphasize that community professionals, including physicians, have multiple roles, really across the lifespan. They certainly have an important role in early detection of features and a specific role in diagnosis. They are also essential quarterbacks in terms of connecting families with specialty clinics, not only autism clinics, but specialty clinics for other health needs. And pediatricians in particular, I think, play a particularly essential partnership role in working not only with the specialty teams, but with the primary care community, and making sure that family physicians feel part of the system, that they feel supported to see autistic kids and autistic adults, so that when those autistic kids hit 18, that there's a prepared primary care system to address their health needs. And I just want to land on this final point, and that is all of the things I've talked about today. I think that there's a risk of kind of medicalizing or pathologizing all aspects of autism, and taking a strength-based approach, kind of recognizing the positive aspects and the strengths that autistic children and youth and adults bring to the world is really important. So I'll kind of end on this slide, which is a summary of a research paper that came out of a research project called Pathways in Autism, a group of researchers at several sites across the country following children from the time they're diagnosed in the preschool years into the adolescent years. And at a few time points in preschool years, at school age, and just before high school, parents were asked as part of a questionnaire, what are the best things about your kids? And at each of those 3 time points, the things that parents identified most frequently were that their children were loving and affectionate, that they were kind and caring and compassionate, that despite all of the stresses and all the challenges, that they were happy, joyful kids, and that they had a wicked sense of humor about things, that really added richness to family life, and that sort of the broader community grew to appreciate. I mean, these are not the terms that jump off the page of the DSM-5, but they're the things that families and hopefully professionals recognize, and they're the amazing qualities of autistic people that kind of keep us coming to work every morning. And I think we have to keep these strengths in mind when we're doing diagnostic assessments and when we're providing ongoing support and care. So with that, I want to acknowledge kind of many wonderful colleagues, including people with lived experience, specifically Jessica Bryan and Angie Ip, who are co-leading the Canadian Pediatric Society Task Force, a number of colleagues on our infant research, a number of colleagues at the Glenrose in Edmonton, including Lynn Sonnenberg, who's been such an important leader in our community pediatric training, and then the organizations that have funded our research. So thank you, and looking forward to your questions.
Excellent. Well, we do have a lot of them, so we'll try and get through as many as we can in the time we have allotted. I'm going to do this in 2 parts because there's a number of questions that seem to be related to the challenges getting diagnosis. We already fielded one, and we have a new one. So I'm wondering if you can help answer this specific question, but also talk about the broader challenge that you've seen in your experience of parents believing that there's a need for a diagnosis and not being able to get that through doctors. So the specific question is, do you have recommendations for diagnosing a child you suspect is high functioning and may not check all the boxes? And then maybe talk a little bit about the broader challenges of some diagnoses that we see.
Yeah. So, in terms of the first question, and I think I have to say, as I feel we've moved away from this term high functioning, because autism, no question, is a multifaceted condition, and so that single yardstick doesn't really capture the diversity. I think that often what people are referring to is like maybe the features are a bit more subtle, maybe language and intellectual abilities are more advanced. So and absolutely that group of individuals tends to fly under people's radar. And to be honest, although I think we still have a lot to learn about how we support community teams in seeing those types of individuals, I think that there's a level of complexity if someone has kind of gotten to 8 or 10 or 12 years old and never been diagnosed, that may be where the specialty teams need to kind of focus their energies. And so it's a bit of a domino effect, so that if we can create some capacity in the community for children who have a more straightforward presentation, that may actually free up some assessment time. I don't think there's any single kind of tip to sort of identifying autism where it has a more subtle presentation. It's partly keeping an open mind and really focusing on what the actual criteria are, and sort of trying to put out, kind of bracket in your mind those stereotypes of autism that don't necessarily apply across the spectrum. So, you have someone who's carrying on a conversation, who's kind of learned to make eye contact, or a 4 or 5 year old who's like incredibly gregarious and charming, but put them in a room of 4 or 5 year olds, things kind of unravel. So I think it's sort of even just recognizing that autism has a range of presentations and knowing what those features are. And I think the broader challenges, I think all of this is interconnected. So I have to say, sort of one challenge that we're finding in my community is that the pediatricians who did this training and are doing autism assessment, they are so stretched because of other challenges in the health system that it's harder for them to carve off the time to do this work. So part of it is making their job a bit easier by supporting like the information gathering phase, or making sure that they have the report templates so that they can kind of quickly get those reports out. But it's also making sure that we address issues in the healthcare system more generally, so that people that would be inclined to do this kind of work don't kind of get pulled away with what they feel is more urgent. Because I think there's a risk that autism assessments will never quite rise to the top of what seems like an urgent kind of health need, because of people waiting for hours in the emergency room, or kind of having sort of more of these acute presentations. But if we don't address the gap in the workforce versus the number of people that need to be assessed, we're not going to be able to make progress. So again, we need to be creative and flexible, but we have to recognize that we're not operating in a vacuum, and that it's a tough time to do this kind of training. People are so stretched right now.
All right. Well, this next question I can field, because you've been going pretty strong here for the last hour. Can families awaiting a potential autism diagnosis access the Autism Ontario resources? The answer is yes. The Autism Ontario website is robust and full of information, and you can reach out to them as well for further, and it's available to all people in Ontario and I believe beyond. You've mentioned a couple times throughout that there are challenges as kids get older. Can you mention some signs that you would specifically look for in older kids without a diagnosis, like 9-year-olds and 10-year-olds, things like that?
Yeah. So I think that I think for those of us used to coming in with a simple checklist, like, does he make eye contact? Does he show interest in other children? Can he transition between activities? You have to sort of put that aside and kind of get to the essence of really what autistic features are. It's really more about the flexibility and fluency of interacting and expressing oneself across a range of situations. So it's more about, can he pull it off with a range of people, or is it only with his parents and very best friend? When she is playing an imaginative game, does it need to follow the script of a favorite video or manga, story? If someone, if she's got a new friend, is there a bit of give and take about what they play? And even if that friend is willing to play that girl's sort of favorite game, can they change up the storyline a little bit? Is it possible to have a back and forth conversation about something that someone else wants to talk about? And what is the sensory environment like? And are there certain environments that are avoided? To kind of dig a bit deeper. And the flip side is, are there certain things that are kind of soothing and calming that have a sensory element to it? So just recognizing that the DSM defined features are pretty broad and kind of getting into some of those subtleties and nuances. And I say subtleties, it may be subtle to me, but for the person living it, it's pretty profound. I mean, sometimes what may not seem quite as obvious still has a huge impact on someone's life.
Right. Okay. Well, we're nearing the end of the time that we have allotted. So I want to remind everybody who is watching that this webinar will be recorded. It'll be available on demand on the Autism Ontario website tomorrow. You can come back and relive the experience, but you can also share this link with anyone who you think might find it valuable. The more people we get through the program, the more we are able to do. The more of these sessions we're able to do, and the more we're able to help educate and inform. We got something new here. Before you leave, there is a survey that we would like you to fill out. It's available on the left side panel. It'll also show up for you when the session ends. Please fill in the survey so we can help run these webinars better. Before we leave, Lonnie, you've touched on a lot and you've answered a lot of questions, but if there's one main point you would like to ensure our audience hears before they leave today, what would that closing point be?
Yeah, I mean, probably the most important thing is don't give up. I mean, you are your child's best advocate. We are all working together to try to make the system better. I mean, there's a lot of challenges and hurdles along the way. I think that from a fundamental, respect for human dignity and in a universal health system, we do need to do better. It really is going to take working together. I think it's really being inspired by parents and autistic individuals' lived experience of how we can improve the diagnostic system, and also huge shout out to the community professionals that are willing to get involved in this type of work. I mean, it is a bit of a learning curve. It's incredibly gratifying and satisfying. And you're making a difference. I mean, there are only so many specialists out there, and I really do think to address these issues, we need to kind of work more closely together and think about how we grapple with these issues. And for autistic adults and parents of autistic adults, please don't give up. I mean, we need to work on building a better system for your needs as well. So again, thanks everyone for participating today.
It's quite often it's easy to get wrapped up in the challenges and in the deficiencies of the system. I found it very aspirational today hearing from you what is happening and the steps that are being taken, and a confidence that this stuff that the concerns that we heard today around wait times and stuff, that there are strategies that are being deployed to help improve that. I want to echo what I'm getting. The Q&A is getting blown up right now, thanking us for the presentation, getting them answers, and just how great it was. Great. So thank you so much, Lonnie. Thanks on behalf of Autism Ontario. I want to thank all of our attendees. Lots of great feedback in here. And we look forward to seeing you at our next Autism Ontario event.